Bismillah ar-Rahman ar-Rahim. Assalamu alaikum everybody. I hope that you are in good health and prosperity. We are starting new topics about drug treatment of mood disorder. Mood بالعربي in Arabic means المزاج mood disorders اختلال المزاج. I will divide this topic into 4 presentations. In today's presentation inshallah, which is the part 1, I will talk about the different types of depression and their mechanisms. My name is Abdullah Salim Al-Hawazi and I would like to welcome you to my channel. So we go straight to our goals, what we are looking for at the end of this presentation. We should know what are the different types of mood disorders, including depression, mania, and manic depression. We should know what are the different types of mental depression and how this depression takes place, or what are the mechanisms involved in depression. And we are going to speak as well about the classification of antidepressant. In the next presentation, inshallah, I will talk about the groups of antidepressants. So let us start from the very beginning. What does it mean, mood disorder? The mood of any person can be normal, he's living a normal life, or it can be depressed. The mood is depressed. In this case, this will lead to what's known as depressive disorder. Depressive disorder. Depressive disorders usually it is a persistent feeling of sadness. The person is feeling sad all the time. Of course, he will suffer from hopelessness and he will suffer from lack of interest in daily activity with other symptoms as well. So these are the depressive mood. When the mood is depressed, the opposite, sometimes the mood will be elevated. The person will feel euphoric with high energy and racing thoughts. This is known as mania. Mania is abnormal elevation of mood accompanied by high energy and racing thoughts and impulsive behavior. As you can see, mania is the opposite of depression, which involves mood. Sometimes the person will suffer from both, from mania and depressive disorder. Some days he's suffering from mania, and other days he's suffering from depressive disorder. This is known as manic depression, manic depressive disorder, manic depressive disorder. It is known as well as bipolar illness, bipolar illness. So this is the disturbances which can take in the mood, either depressed mood producing mental depression, or elevated mood which can result in mania, or both. In this case, it is known as bipolar illness, as we will discuss later, inshallah. Okay? So what are the type of depressive disorder? Depressive disorder. Types of mental depressive disorders. There are many types, but I will concentrate on only 4. Only well known for depressive disorder. The first is known as Major Depressive Disorder. It is abbreviated as MDD, Major Depressive Disorder. The second is known as Persistent Depressive Disorder. Persistent Depressive Disorder. Now, what's the difference between these two? They differ in the duration and they differ in severity. In Major Depressive Disorder, usually they are shorter duration. And a person will suffer from episodes of current depression for a certain period of time, then he will be recovered and he will have a normal mood, and then he will have another attack and so on. Usually these recurrent episodes of depression, they are severe in nature. Opposite, the persistent depressive disorder, they are of longer duration, but they are less severe. Okay? If the major depressive disorder, they are recurrent episodes of severe depression, while persistent depressive disorder, they are longer, less severe attack of depression. Both of them, they share the same symptoms. What are the symptoms usually? Is the feeling of sadness, the feeling of sadness, the feeling of hopelessness, and loss of interest in normal daily activity. If these are the major symptoms of major depressive disorders or persistent depressive disorders. Usually, this is accompanied by other symptoms, including, for example, insomnia or sleep disturbances, might include fatigue. The person will feel fatigue all the time. They might contain loss of appetite. The person he loses his appetite, and so on. If these are the most common forms of depression in major depressive disorder and the persistent depressive disorder. What's the difference between these two? They differ in duration and severity. Major depressive disorder, usually they are more severe in its attack, but of shorter duration. On the other hand, the persistent depressive disorder, they are of longer duration. They might continue for years, while they are less severe in forms. What are the symptoms? The symptoms include sadness, hopelessness, loss of interest in normal daily activity, and other symptoms like insomnia, like fatigue, like loss of appetite, loss of sex drive, and etc. These are the most common two forms of depression. Third common is known as seasonal affective disorders. Seasonal affective disorders. ومن اسمها جاية seasonal. What does it mean seasonal? Means that they take place in the change in seasons, with symptoms occurring in the same time each year. Like for example, في winter months. Like what happens in winter months of long nights and short days and no sunlight, especially in the cold weather, in the cold countries like the North America and North Europe. The other type of mental depression is known as postpartum depression. Postpartum depression. من اسمها postpartum معناها this depression will take place usually after childbirth. After childbirth. Usually it continues for a certain period of time and then recovery will take place. Usually these symptoms, sometimes they are extreme sadness with anxiety and exhaustion. These are the four different types of mental depression. Next, we are going to talk about the mechanisms involved in depression. Why depression takes place? Why depression takes place? Why some people they suffer from depression and other people they don't suffer from depression? They said that depression is due to low monoaminergic activity. Low monoaminergic as we know in the monoamines, they are, as we talked many times before, monoamines, they are neurotransmitter in the brain and periphery as well. And these monoamines including the 5-hydroxytryptamine or what's known as serotonin. It includes noradrenaline, it includes adrenaline and dopamine. They said that serotonin, 5-HT, and noradrenaline, they are involved in depression. When these monoamines, they are low in activity in brain, this will lead to depression. Why they suggested that? why they suggested that. Why they said that depression is due to low aminergic activity. If we look at the monoaminergic nerve terminal, if we just look at the monoaminergic nerve terminal, as we know, in the monoamines, after they are synthesized, as you know, they will be stored in the storage vesicles. In the storage vesicles, اتخزنوا. After storage, when action potential comes, action potential, nerve activity comes, they will lead to opening of calcium channel, and this opening of calcium channel will lead to fusion of the storage vesicle with the presynaptic membrane, and this will release monoamine at the synapse in a process known as exocytosis. Exocytosis. Okay? Now, once monoamine it is released, it will act either on postsynaptic receptor, as you can see here, postsynaptic receptor, or they will act on presynaptic receptor. presynaptic receptor. يبقى المونامين اللي هو ال 5-HT or adrenaline or noradrenaline, after they are released, they will act on postsynaptic membrane receptors, or they act on presynaptic receptors. So presynaptic, as we said before several times, they are known as autoreceptors. Autoreceptors. What does it mean, autoreceptors? They control the release of the neurotransmitter, okay? This is how activity begins. Once they are released, after release, how their activity is ended, how the physiological inactivation of the monoamines. This takes place by reuptake into the nerve terminal. Reuptake, a process of reuptake. There are specific transporters in the membrane. These transporters will transport the monoamine from the synapse into the nerve terminal. Once the monoamine inside the nerve terminal, some of it will be metabolized by monoamine oxidase. This is a cytoplasmic enzyme present in the nerve terminal, which will lead to oxidation of all monoamines, 5-HT, noradrenaline, adrenaline, and dopamine. Okay, and some of it will be stored in the storage vesicles. Some of it will be metabolized, يحصل له metabolism, some of them will be stored in the storage vesicles again. So this is the normal monoaminergic activity. هذا النشاط الطبيعي اللي يحصل عند نهاية الأعصاب المونوامينرجية. Now, so why they said that depression is due to deficiency of the monoamines? Because they found in most of the antidepressant drugs كلهم تقريبا, most of them, they act by increasing the availability of the monoamine and the synapse in this area. How they do that? By different mechanisms. And first, by inhibition of the reuptake. زي ما قلنا المونوامين after it is released, how it is inactivated, كيف يحصل له نهاية المفعول متاعه, by reuptake into the nerve terminal. Therefore, if we inhibit the reuptake, more monoamine would be available in the synapse, معناها more monoaminergic activity. They found it is true with several drugs, including serotonin, selective serotonin reuptake inhibitors. These drugs, as we will discuss inshallah in next presentation, this group of drugs, they inhibit reuptake of 5-HT, اللي هو serotonin, 5-HT or serotonin. They inhibit the uptake of 5-HT, معناها increase the availability of the amine at the synapse, and this will result in more aminergic activity. Another group of drugs, they inhibit both serotonin and noradrenaline. They are known as serotonin norepinephrine reuptake inhibitors. Serotonin norepinephrine reuptake inhibitors. ده باختصار يسموهم SNRIs. Okay? These drugs, as we will see later, they inhibit both the uptake of serotonin and norepinephrine, increasing their availability in the synapse. Another drug اللي هم tricyclic antidepressant مشهورات very famous. They are not of important clinical use nowadays, ولكن they are first group of drugs introduced in the treatment of depression. These tricyclic antidepressant, they inhibit the reuptake of both serotonin and norepinephrine, the same thing, but as well they block other receptor, as we will see later. Okay. The fourth group of drugs, they inhibit the monoamine oxidase. As we have said, the monoamine oxidase is cytoplasm. It breaks down or oxidizes the free monoamines present in the cytoplasm. Therefore, if I inhibit the monoamine oxidase, all the monoamine sensitized and صار uptake will be stored in the storage vesicle. So storage vesicles will become enlarged, containing large amount of monoamines, which be released in larger amount. Amount released will be large. Amount released at the synapse will be large. This will increase in monoaminergic activity. This is the fourth group, monoamine oxidase inhibitors. What they do? They inhibit the monoamine oxidase in cytoplasm, increase the amount of monoamine stored اللي مخزنة حتزيد، بالتالي اللي ريليزد حتزيد كذلك، الكمية اللي تفرز في النهاية العصبية حتكون كمية عالية، وبالتالي this will result in more monoaminergic activity. Okay, these are four groups which act by increasing monoamine at the synapse. The last group, they have nothing to do with the monoamine levels. They act on the presynaptic receptor. They act on the presynaptic receptor. So that's why they are known as atypical. Atypical معناها مختلفات على التانين. التانين what they do, the other four groups, they increase the availability of the monoamine at the synapse. These drugs, they have nothing to do with the availability. They act on the presynaptic receptors, inshallah, as we will talk about in the next presentation. That's why they said that depression is due to low monoaminergic activity. Low. معنى المونوaminergic activity is low. وهذه يسموها المونوامين theory of depression. Monoamine theory of depression. This theory suffered from several drawbacks. Okay? Many people, they said, no, this is not true. Why? Because this theory does not explain why the action is delayed. Therapeutically, all these antidepressants, which we talk about, all of them, their therapeutic effect usually is delayed. It will take 3 to 4 weeks to develop, while the increase in the aminergic activity is immediate. Okay, these drugs, they increase immediately the availability of the monoamine at the synapse. ولكن therapeutic effect is delayed. This is one drawback. This is one drawback of this theory. This theory cannot explain why the therapeutic effect is delayed. It's not immediate as the increase in the monoaminergic activity. Another, they said that why other drugs which will increase the availability of the monoamines at the synapse are not antidepressant. For example, amphetamine. مجموعة الأمفيتامينز مشهورات. Amphetamines, they increase the availability of the monoamine at the synapse, but therapeutically they are not antidepressant. They cannot treat major depression. Okay? So these are the drawbacks of the monoamine theory of depression. In 2004, I have written an article in well-known scientific journal suggesting that the antidepressants, they have two actions on the monoaminergic system: an acute action and chronic action. The acute effect is to increase the availability of the monoamines at the synapse. This usually, as I have said before, it takes place immediately after taking the drug. Then a chronic action, which takes place after 3 to 4 weeks of administration with antidepressant. This action will result in desensitization of presynaptic monoaminergic receptors. As we know, in the presynaptic receptors, as we have said several times, the presynaptic receptors, which are present on the nerve terminal, usually they are autoregulatory. What does it mean, autoregulatory? That means they affect the release of the monoamines from the synapse. They have inhibitory action. They inhibit the release of the monoamine from the nerve ending. We have several autoregulatory receptors in the monoaminergic neuron, including, for example, the 5-HT1B receptor, which are present on the serotonergic nerve terminal, and we have as well an alpha 2 receptor, which is present as well on the serotonergic nerve terminals. And these type of receptors, they are known as heteroreceptors, as we have discussed before several times. While the 5-HT receptors present on serotonergic nerve terminal is known as autoreceptors. Therefore, these autoreceptors and the heteroreceptors, when they are stimulated, which present in presynaptic nerve terminal, they inhibit the release of the monoamine. معناها they will decrease the availability of the monoamine at the synapse. Okay? Now, therefore, if we desensitize means that these receptors becomes less active. In this case, the release will be increased. معناها increase the release of the monoamine because the inhibitory effect is removed. The inhibitory effect of these receptors on the release of the monoamine is decreased or removed. So what will happen after desensitization of the presynaptic monoaminergic receptors? This will result in increased release of monoamines, especially 5-HT and adrenaline in certain parts of the brain. This increased release معناها increase in monoaminergic activity. Monoaminergic activity. This was found to be true by research. Okay, so this have given a support to the monoaminergic theory that the antidepressant drugs, they act through the monoamines. How do you do that? By an acute effect, by an acute action, and a chronic action. By an acute effect and a chronic effect. The acute effect, they increase the availability of the monoamine at the synapse. How do you do that? As I have explained, by either inhibiting the reuptake or increasing or inhibiting the metabolism. Also, they produce a chronic effect. This chronic effect takes place after 3 to 4 weeks of administration of the monoamines. What they do? They produce desensitization. Desensitization means decrease in the sensitivity of the presynaptic receptors. The presynaptic receptors, they might be alpha 1 receptors, which are heteroreceptors, which are present on the serotonergic nerve terminal, or the 5-HT1B receptors, which are autoreceptors. They regulate the release of 5-hydroxytryptamine from the nerve ending. These receptors, as I have said, 5-HT1B and alpha 2, they are inhibitory. What does it mean inhibitory? They inhibit the release of the monoamine. they inhibit the release of the monoamines at the synapse. Therefore, if we decrease the sensitivity of these receptors, in this case, the release of monoamine will be increased. Increase the release of monoamines. Increase the release of monoamine will result in an increase in the dopaminergic activity, and this will end up with antidepressant effect. Okay, so this is how the monoamine theory of depression stands. Actually, this paper was published about 20 years ago and is still valid, and it is used in more than 700 citations in the literature, of course. Okay? Now, so this is the monoamine theory of depression, the old theory which reflects the acute effect of the antidepressant drugs, and the new theory which reflects an acute and chronic effect of antidepressant drugs. So these are all about the classification and the types of mental depression and the mechanisms involved. So if we summarize what we have said and conclude as well what are the points that we are going home with, first we have known that mood disorders can be low mood, which results in mental depression or major depression, or mood can be high, which can result in mania, and some people will suffer from a combination of both manic depression. We have said that depression comes in various forms, such as major depressive disorder or persistent depressive disorder, which are similar and they are different, similar in symptoms, but they are different in severity and duration. We have said that major depressive disorder usually they are of shorter duration and more intensity or more severity, while persistent depressive disorder usually they are of longer duration and of less severity. Other common types of depression are seasonal affective disorder, which results due to change of a season, especially in winter, and the postpartum depression, which takes place usually after childbirth. We have said that depression is related to a deficiency in the monoaminergic activity, especially 5-hydroxytryptamine and norepinephrine. And we said that the antidepressant act either by blocking the reuptake of the monoamines, like serotonin, selective serotonin reuptake inhibitors, or selective serotonin and norepinephrine reuptake inhibitors, or by inhibiting the metabolism by inhibiting in MAO inhibition, or they might affect the presynaptic autoregulatory receptors. We have said that according to the monoamine theory of depression, antidepressants they have two main actions: acutely, where they will increase monoamines at the synapse, and chronically by producing desensitization of the presynaptic autoregulatory receptors. We said that this chronic effect will result in the antidepressant action. This will give support to the monoamine theory of depression. So this is all about types of mental depression and their mechanisms. I hope that you enjoyed this presentation. I would like to thank you very much for your attention, and we end up with the Quranic verse وفي أنفسكم أفلا تبصرون صدق الله العظيم والسلام عليكم ورحمة الله وبركاته. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.